Hi, I'm Megan Norman, and this is a new series called Made for Minnesota Moms. I'm a mom of three and a Minneapolis newborn and family photographer. I'm hoping for real conversations with Minnesota women who support pregnancy, birth, and postpartum, sharing resources you can actually use because the internet at 2 a.m. can be a lot. My first guest is Dr. Jessie, the founder of Chiro for Moms, a clinic that specializes in chiropractic care for women with a focus on pregnancy and postpartum. Dr. Jessie, thank you for being here.
I'm so happy to be here.
Before we get into it, can you tell us a little bit about you and what made you want to support women through pregnancy and postpartum?
Yes, I am a mother of two young women. They're 12 and 14. At the time when they were born, I was newly out of school. So I've been a chiropractor for about 15 years. And my background was sports med. I had no interest in pregnant women or postpartum women or babies, but it found me. I was working in a medical arts building where the OBs were sending me all of their pregnant patients, and I was getting really great results with what I was doing because I think I took a lot of what I knew with my athletes and applied it to pregnant women. Anyway, I took that and years down the road created this space that I'm in now. And then I think took a lot of my passion surrounding women's care after having gone through it myself as well. So, I mean, it's morphed over the years, but that was the genesis of this place, was just the beauty of what prenatal care is, and also the fact that we're not really taught a lot of this in school. So I was kind of pioneering my own way through with prenatal care, getting good results using those tools. And then we've kind of brought that into the clinic here and just continued to really build around a lot of our anecdotal evidence and the results that we get with women during pregnancy, after pregnancy, and with their babies. And so that's kind of me and my passion. I am very passionate about women's care, and I love motherhood. I love so many aspects of it. So this place really does fill me up, and we've set this place up to be really thoughtful for women. So a lot of my own frustrations that I had when my kids were little, going places, I've tried to rectify, tried to kind of fix and change down to the time frame for care and not having treatment plans and having trashes up off the ground. I mean, just little things, but they end up as a clinic making it feel very different. So, yeah,
Yeah.
that's
Well,
me.
I will say I am one of your patients and I just love being there. And I love it because so with my youngest, I can bring him along and he's just as excited to come along. So, because it's a fun spot and it's something I wish that I would have thought of for myself when I was pregnant with any of my kids. And so, what are some of the misconceptions you hear about prenatal chiropractic care?
Well, that it's not safe, but it is safe. It is one of the best things you can do in regard to pelvic alignment and prepping for labor and delivery. So, pain aside, it's just an incredible tool to really optimize delivery. We now have research that didn't exist when I first started, but it shows that chiropractic, with so many visits, which is usually like 4 to 6 throughout a pregnancy, decreases labor and delivery time by 25%. So what it's saying, and sometimes it's even more depending like with subsequent pregnancies, but what it's
Amazing.
saying is that alignment matters. It
Yeah.
matters so much that it can literally cut 5 hours off of a 20-hour labor. I mean, that's
And
insane when you
who
really think
doesn't
about
want
it.
that?
I know, right? And it means baby is coming out in maybe an easier fashion, or maybe you just have more energy during and
Yeah.
following. I mean, there are a lot of pieces to all of that, but I think it's that it really does make a huge difference. It is super safe. Um, chiropractors across the board are very different, very, very different. So we can do lots of different things across many different clinics. All I can talk about is what we do in here. But the thing that people are sometimes surprised by is how much body work we really do. So chiro means hand and chiropractic means to practice with your hands. That's how we approach it in here. So I think people are often surprised by how much work we do for the pregnant body and that we're not hurting them in addition to that, that we're actually getting really good work done and doing really good hands-on work and not hurting mom or baby. I think that's always a little surprising, especially if people have had other experiences in chiropractic clinics where they either move quicker or they maybe use different tools that aren't as effective or just have had different experiences. So I think that's something that people are always a little surprised by when they're in our clinic. Yeah.
Well, with you specializing in women and kids with, all postpartum, pregnancy, everything, it for me, it would feel like a peace of mind because you really that's who you're seeing, those are your people. Like
Yeah.
it's wonderful. And so, okay, so if there how many times did you say most you see most of your women who are pregnant?
I'd say 4 to 6.
Okay, so how
I
does that work with the trimesters?
It's a great question. We typically, even if we're seeing patients before the 3rd trimester, we're seeing them probably once a month tops. So even if they're coming in from the very beginning, that's maybe 3 or 4 times, right? Just depending on where that lands. So really, I feel like the majority of when we see patients is 30 weeks and beyond. We start what's called the Webster Technique at 30 weeks, which is a technique that is specific for chiropractic. You have to be certified in it. But at the end of the day, it's really taking a look at pelvic alignment and ligaments and how the pelvis is aligned leading into labor and deliveries. I would say the patient hasn't been in until 30 weeks and now they're coming in for the Webster Technique, which is something people look for. They would come in probably every 2 to 3 weeks for months 7 and 8, and then maybe once a week through that last month, or maybe, a few times in that last month, depending on when they deliver. But I'd say that's a pretty nice cadence. So they're not in here all the time. They're not in here every week. They're not in here multiple times a week. We try to set them up with a lot of exercises and stretches and movements to do at home to live life. And then we see them, I would say majority is through that last trimester for sure.
I mean,
Yeah.
I just think about how not I don't know if hard is the right word, but it is just a lot on our bodies. So I feel like it's such great self-care to just come in, see you, get aligned, talk about all the things, feel comfortable. And if you have other kids, what I love is you are all about bring them. It's like a whole thing because as moms, I know it's so hard for us to do that self-care and to prioritize ourselves. And it makes it that much easier when we can bring our littles in tow and know that they're having equally as an amazing time as we are taking care of ourselves. So, okay, so what happens after baby? Like, do you see a lot of your moms after baby or how does that work?
Yes. So I encourage mothers to rest as much as they can within that first month. But sometimes they're dealing with things that are mechanical that we can fix. So a good example of that is if a mom falls asleep with her baby and wakes up and has tingling numbness down her arm, which is typically coming from compression in the neck, or she can't turn her neck, she's literally stuck here. That's typically going to be mechanical, and chiropractic can make a huge difference. The earlier you work on bodies for things like that, the easier it is to fix because then the muscles can't shorten and stay shortened for a long period of time. So like that we'll do earlier, but I encourage moms to rest as much as they can if they're feeling all right. For postpartum though, in addition to chiropractic, it's lactation help, which we have in here. It is pediatric baby help. So again, if a patient is dealing with something, maybe both mom and baby with latching or torticollis where the baby's head is off to one side and then they're getting that
Yeah.
flat spot on the back, or they're kind of colicky, that can be a really nice, like chiropractic can be a really nice way to work with parents for all of that. And then we have pelvic floor therapy as well, which ends up being really, really beneficial postpartum. And that's it, but that's a lot.
That is a
So
lot.
yeah, so we see postpartum mamas for lots of different reasons, but they're usually kind of overlapping with the things that they're dealing with. And so when they're in the office, they can kind of pick and choose what's best for them. Like we have a patient right now, she comes in weekly right now because she's working on stuff. And so she gets treated the exact same time that her toddler gets treated by Dr. Beadle, and then her infant gets treated by Dr. Jess. And we're all in the same room together. So all 6 of us are in here, and
Awesome.
she's in and out in 30 minutes, which is actually a long time for an appointment. But because all 3 are getting treated at the exact same time, but we're all getting different things done for different
That's
reasons.
awesome. Well, and it
Yeah,
just makes it's like a one-stop shop.
kind of. Yeah, it's fun.
I love that.
Yeah.
Okay, so I'm sure you do, but do you have like one powerful moment from your work that you'll never forget? I guess, can I ask
I
that question? Can you
You
share those things?
can.
I should ask.
You
I'm not
can.
sure.
Well, it's actually not even from this clinic, but I feel like it was a very powerful moment that pushed me to never stop doing this because I was so surprised by it. So
Okay.
in the early days of figuring out that I wanted to build something here, a lot of it was having to just watch and see, like, am I good at this? Am I passionate about this? Can I actually get results? And what happened was I had a patient that was sent to the office, but she showed up in a wheelchair and she couldn't get out of it because she couldn't walk. Myself and her husband lifted her out of the wheelchair. And when I put her on the table, I had to do everything kind of backward from what I would normally do because she couldn't lay face down. She had to be face up and she was pregnant.
My
And
goodness.
I adjusted her just based on feel, on what I was feeling with my hands. And she got off my table and walked out of the office. And even for me being the chiropractor doing this, I remember thinking that it was just wild that I could do that. I mean, she was essentially crippled relative to pregnancy. I mean, feeling like she was going to spend the rest of her pregnancy in a wheelchair. And she was probably 32 weeks pregnant-ish.
So she
But
still
I
had some
remember
time to
that.
go.
What'd you say?
She still had some time to go.
Yeah, exactly. I think moments like that led me into this. I have now seen many different things that blow my mind in patients leaving the office, but I feel like it happens every day now. I don't feel like I even have a singular thing to tell you because with us being so boutique and so niche and cash, patients have to feel better when they leave. So because we don't set them up on a treatment plan, when we're done treating in one session, they have to feel better. And if they don't, we are finding a different way to get them feeling better. We don't just say, we'll see you next visit and just keep doing the same thing. And so I feel like on the daily, we are seeing crazy things happen with the mechanics of a pregnant body. So
Awesome.
yeah,
Hey,
it's neat. It's neat. It is still neat. I'm 15 years in, and I don't think there's a single day that happens the way I think it's going to. And it's so fun. It's so fun. Every day is fun. Yeah.
I love that. Well,
Yeah.
and I feel like it's, I mean, in my case, I watched you for so long on social before I actually came in to get treated. And then it's like, I just felt so comfortable from the moment that I walked in, the way that you approach things, the way that you talk to everyone. It just feels, I don't know, like you're just seeing your friend and then you walk out of there feeling like $1,000,000. I don't know. I mean, there is so many times I've gotten in the car and I'm like, whew, I can move again. I feel like a real human again. Yes. No, I
Thank you.
love it.
It never gets old hearing that. So thank you.
No,
I
I
get
love it.
uncomfortable hearing it, but thank you. I love hearing that.
What makes Chiro for moms and kids so unique and different than other chiropractic clinics?
The thing that makes us the most unique is the fact that we treat only women and in the adult side of things. When you treat only women all day long, you get to really hone in on the differences between a woman's body and a man's body, and then you're naturally treating more of them. So within our population, we don't mix in an older population and men and other people. It's women between really like 20 years old and 40 years old. It's kind of a small window. And when you do that, you get to really figure out what those bodies do within that age range and then within pregnancy. So we just see so many more pregnant patients than anybody else, and so many more women than anybody else, even high volume practices. Because it's so focused, we spend a whole day on women only. We're not jumping around. And so I think that's the thing that makes us incredibly unique. And then I think just the time that we spend with patients is part of that as well. Just that we do spend a lot of time with our patients, and not every chiropractic clinic does that. So chiropractic is kind of notorious for quicker appointments, and sometimes that's wonderful. And people just need that. They need to be able to get in and get out. We offer the longer appointments, and I would say especially during pregnancy, that's something that makes us very unique, is that we spend a lot of time and we do a lot of muscle work. And not a lot of clinics do the muscle work part that we do, and it just takes time to do that. So I would say those are the things that make us really unique.
Well, I mean, granted, I've known you for a while and I see you, but you're so strategic about the level of care that you give, how the care is, how everything is set up. You always have your patient or the mom or your kid, you always have them in mind, no matter whatever decisions that you make for Chiro for moms and Chiro for kids. And we can feel it. We can feel how much you love what you do and how much you care for us. And so I wish that I would have found you when I was pregnant with Olive, because it would have been, I think it would have gone differently. And especially hearing like what you do, and like I know what you do for me, and I'm not pregnant, obviously, when I've seen you, but
Yeah.
like just how much it would have benefited, just, yeah, how my body, my mind, like all of those things. And also to be in an environment where you know someone really does care about you. And I also really love that you all have like your strengths that you like. So I have seen you, I've seen Dr. Beadle, and I've seen Dr. Jess, and you all have different strengths. And it's so wonderful how much you collaborate and work together. And like, just because I've seen you doesn't mean that you can't see Dr. Beadle and like you can't see Dr. Jess.
I love what you just said, because I do think that's a piece I couldn't have planned for it, right? I could not have planned that. But it is one of my favorite things about where we are at with the clinic right now, is that we all do have different strengths and we don't compete over them. We really honor them and we really encourage them for each other. And that's real. So I appreciate you saying that.
I feel like you have created such a special space, and that is makes it feel so good. And like as a woman, you feel like taken care of and welcomed, and your kids aren't annoying, like you truly embrace them. I remember my youngest Ford run around in and out of the room, and I feel safe, and it's such a wonderful place. How would you describe your approach and care in 3 words?
My approach to care: patient driven, results driven, and probably heart forward.
That. And I would agree with all 3 of those.
Okay, good.
Those are wonderful. Okay, so last and but not least, where can Minnesota moms connect with you and learn more about your services?
Instagram is a good place to be. That's at Chiro_for_moms. We also have Chiro for kids, the same thing with the underscores, and pelvic floor for moms, same thing with the underscores, pelvic floor _for_ moms. Those are great. Email is great. If you have real questions, you don't have to have an appointment to ask. Always. Those are the best.
And I'm hoping that maybe Dr. Jess, or like we could get some more of the fabulous doctors that you have to also talk to me about their awesome, zones of genius. I love that saying. And someone said that, and I love that. Your zone of genius.
I do like that too. I really like that.
Anyone that people see at Chiro for Moms will meet them where they're at, and hopefully feel just as welcome as the rest of us do, because that's how you make me feel.
Oh, thank you. This was fun. All the
This was
compliments.
fun. Well,
Nice.
I mean it. And thanks for being my first guest, because I don't know what I'm doing. And I was really nervous about this. And I practiced my beginning many, many times. I have lots of videos of me saying it.
I thought it was wonderful. I really did. I love this.
Well, I'm excited. I really am truly excited for this series because I feel like I just there's so much to learn and so many different resources of
Yeah.
people and women who are willing to help and be supportive and cheer you on and do all of the things. And I just didn't realize, I just didn't know about a lot of things. Like, you in
Yeah.
particular, getting
Yeah.
chiropractic care while I was pregnant. So it just will be fun to meet other awesome women in Minnesota and just talk about ways that we can support women who are making other people, other humans.
Yeah. I
All
love
right.
it.
Well, thanks, Dr. Jesse.
Thank you.
You're wonderful, and I appreciate you.